Hi everyone, welcome to this preview presentation for my capstone project, which explores the current model for end-of-life care and what lies ahead. A quick note, because my research covers a variety of different types of end-of-life care, I'll be using the term end-of-life care, which includes hospital palliative care, hospice facilities, and nursing homes. And all of these different types of end-of-life care have the main goal of limiting suffering and increasing comfortability in the final days, months, or even years of a dying individual. So by the year 2040, more than 15 million people will be over the age of 85 in the United States. And as our aging population continues to increase, there will be an increased strain on our existing healthcare system, which includes the services for those seeking end of life care. So, our current palliative care or end of life care model has set many dying individuals and their caregivers and families up for failure, and little has been done to rectify this. And communities of color are hit the hardest. They're experiencing a lack in availability of quality and culturally competent end of life care. And if this current landscape does not change, then millions of these dying individuals and their communities will not receive the support that they deserve. And the current strategies presented in my research do not adequately address the barriers, and little is done to address the lack of culturally safe care for these communities. So, because there are these barriers to care, and because the current strategies are really not cutting it in addressing what needs to be done, my advocacy position stresses that there is a necessity for a new holistic approach to end of life care that works to provide this culturally competent care for communities of color and also support the communities at large. So, the structure of my capstone project is a possible solutions pattern, and I focus on three main themes. First, I discuss the barriers that people of minority groups face to access end of life care, which leads to a decrease in satisfaction at the end of life, as well as a decrease in satisfaction for the family members involved. Now, this research is well established, but what's lacking is the current intervention strategies. So, I explore these interventions and how they try to address the barriers, but mainly I emphasize the gaps of these interventions. And finally, I argue that because the current interventions have these gaps and are lacking, um, and will only really address a small part of the problem, I introduce the emerging intervention strategies that not only work to dismantle the barriers to access, but also redefine end of life care in general to include this more holistic model and to address the needs of the interpersonal network of a dying person. So, my advocacy position focuses on really changing the end of life care model to a more holistic model and the need for that. And from my research, we're just starting to see a glimpse on the horizon of this change. But for this preview presentation, I just want to highlight three areas of research that I found that needs to be further explored. So, the first is we need more research that tests culturally competent death doula practices. And there is definitely not enough research on the more holistic model that death doulas bring, and more scholarship needs to investigate the different ways that people can access this form of end of life care. And like I mentioned before, the research on barriers to access for people of color is extremely robust, and the field needs to pivot away from just acknowledging these barriers and focus on researching ways to remedy the cultural erasure of family practices within the current end of life care model. And lastly, bereaved families are very well placed to comment on the lived circumstances, the health needs, and the satisfaction of their older family members who have experienced receiving services from health and palliative care professionals at the end of their life. So, more qualitative research is needed to focus on those family experiences and focus on family involvement and why cultural traditions are so important at the end of life and in that care process, and how we can preserve those. So how do we create a more holistic model for end of life care? And how do we move away from our more medicalized version that we have right now? Well, I'm just going to highlight two practical actions for this preview presentation. The first being increasing access to death doulas, like I mentioned. Increasing this access can be through a variety of different community based approaches, either through community organizations or it can be offered by palliative care specialists within hospitals. It can also be offered in nursing home facilities or be more readily available in a home environment. And these culturally appropriate death doulas provide that safe and meaningful care within the holistic model that addresses the spiritual, mental, emotional, physical, and social needs of the dying person and their community. The second would be to increase trainings. Now, the first training would be just to train more death doulas. We need more death doulas to provide this quality care. But training also includes a palliative care specialist, either providing trainings to other fields within a hospital to create a more holistic approach within that setting, and to have more doctors in a dying person's network on board. But it also means more trainings within palliative care to address cultural and spiritual needs that have kind of been thrown to the wayside for dying people of color and also their networks. So, these two implications center around the idea that the dying individual has options, which is extremely important when dealing with end of life care. I quickly want to address a limitation in my research in general. This is just the tip of the iceberg, and there is a multitude of different factors that go into end of life care and access to end of life care. And in my research, I don't fully address the financial aspect of this, which includes financial burdens, financial needs to create these intervention strategies and implement them into communities. And I just wanted to address this limitation and gap in my knowledge for this project. But where do we go from here? Well, the field of sociology is lacking in research and exploring inventive and inclusive intervention strategies to increase the quality of care at the end of life. And this is not only for people experiencing these disparities that I've mentioned, but for everyone. Dying is universal, and everyone deserves to have their unique needs met through the support of not only their close family members and their community, but healthcare professionals and those working on a larger scale to provide quality care. So, thank you so much for watching this preview presentation.